The people that work in veterinary hospitals are special. That's good and bad. It's good because they're empathetic and caring and kind, and they work really hard. It's bad because of all of the above. It means that we have to be sensitive to the emotional part of their lives. I was a practicing veterinarian for 23 years, and during that time I noticed trends in the industry. The complexities of running a business were consuming more and more practice owners' time. They were looking for ways to offload that management responsibility. It occurred to me that if we were part of a larger group, that we could use the best ideas from all of us and create possibly something better. So I left practice in 1996 and put together a group of hospitals that all had a similar idea, similar vision. Let us provide the administrative support and other resources and let you just be a doctor, which is what you really want to do.
How do we help these people have a way to retire and that what they've spent 30, 40, 50 years building is going to be taken care of?
A model that creates a network but still allows sites to maintain their brand identity and feel independent. It's unparalleled in the industry.
After we sold the practice to NVA, they were committed to leaving my practice alone, to leaving the culture that I had worked on very carefully over the years to be the same. And I thought that was very important for my clients, also for the staff.
The culture of the hospital gets to be driven by the hospital, not by the organization that owns it. One of the things when I joined NVA was, what are we going to do to impact the profession? And the profession being the people. The first program we rolled out was what we call Health of the Healers, which is a 4-day retreat where we literally take them out of their sites and for 4 days really talk about them as human beings and the contribution they want to make in the world, because it does impact your ability to practice medicine.
The concept of servant leadership requires that we lead from a position of caring and that we're good listeners.
They want to see us succeed, but they want to see us succeed based on what that means to us as a hospital, not just what it means for NVA.
It really goes beyond them, like just providing medical autonomy. Setting up wellness plans is very cost prohibitive and it's a very high administrative burden. We help our individual hospitals set up their own unique plans, which we call PAW plans, so that they can effectively run wellness plans. It's good for them, it's good for the patients, it's good for everybody involved.
Many times individual sites want to be able to innovate, and veterinarians want to be able to advance medicine and don't have access to resources. And so we're able to pool together and think about providing access at the local level and national level that otherwise our teams wouldn't have access to.
You gain the ability to utilize the resources of a much bigger IT department, personnel department, the ability to use the call center, the ability to use the marketing. So your resources are, even though you're in a community practice, your resources are much larger than can be achieved in a single practice setting. Very soon after joining the NVA community, I was invited to be a candidate for the Medical Advisory Board. And that was a really attractive thing to me. The opportunity to contribute to this profession compared to when I was a solo practitioner was much, much broader.
NVA allows me to look at my role creatively so that I can focus on doing what I love, being an advocate for pets, and then to come to the table and have a voice to ask, how could we do this better?
All we have to do is actually stay out of their way and let what already exists in the profession continue to grow and flourish.
If you're somebody who wants to go to work, do your job, be told how to do it every single day, a transactional relationship, then NVA is not for you. But if you want to be a part of something bigger, with a stronger initiative, have the freedom and the creative voice to make a difference, be able to make an impact and set standards, then NVA is for you.